Tonight in Health Connections, getting kids the help they need to cope. And here's more from Omaha. And we're here now with Dr. Sean Akers. He's a pediatric psychologist. We're in Omaha at the Children's Hospital and Medical Center here. And boy, you talk about behavioral issues, and it brings up a lot in our minds, but what exactly are you dealing with here, Doc?
You know, we're dealing with a lot of behavioral and emotional issues. And here at Behavioral Health, we have a lot of psychologists, therapists, psychiatrists, we even have a dietitian. And so what we do is we specialize in working with kids and families with a variety of issues, including anxiety, depression, ADHD. We have an autistic spectrum disorder expert. We have eating disorders experts. And so we really want to encompass treatment of all the childhood issues.
And you say childhood, how young are we talking here?
We go all the way from preschool, even some infants who have some issues such as feeding issues and those types of things, all the way through adolescence.
Why are we seeing more prevalence in some of these issues in kids? Are we seeing more?
We are seeing more. I think there's a couple of things there. We're seeing a little bit more, especially things like depression and anxiety. There just seems to be more pressures and a lot of things going on with kids these days. At the same time, I think we're also getting better at identifying things. You know, we want early intervention. We want to get these kids in as soon as possible to be treated. And I think the better we're at intervening with these kids and then identifying them, the better.
What should parents look for if they think their child may be having some issues?
You know, we're the experts in emotional and behavioral issues, and we really see parents as the experts in their kids. And so what we really want them to do is, first off, pay attention to their functioning. How are they doing at school? What are their teachers saying? How are they doing socially with other kids? How are they doing with their grades? How are they doing with family relationships? At the same time, as they get older, we want them to pay attention. Are there changes in behaviors? Are they seeing differences in their grades? Are they changing their friend group up? Are they isolating more? Are they getting into more trouble? So when we start seeing dramatic changes like that, you really want to start paying attention that maybe there needs to be some help.
If a mom or a dad out in central and western Nebraska sees that their child maybe isn't functioning well, how can you help out?
You know, I think we are the experts in child and adolescent issues, and it's really important to have, to see an expert with child and adolescent issues. There's a big difference in seeing a child versus an adult, and it's important to have that experience and the ability to do that. So, for example, there's even a 5-year difference. There's not much difference between a 25-year-old and a 30-year-old, but there's a big difference developmentally between a 10-year-old and a 15-year-old. And so knowing those differences and how to approach those kids is really important.
And finally, when we talk about emergency care, some of these issues can be very dramatic. What do you want to tell a mom or a dad that might be in real crisis mode here, Doug?
You know, get help and pay attention. There's treatment for these issues. And when we pretend that they're not there, or we just hope that this is a phase, oftentimes you're going to lead to more issues. And so, make those phone calls and seek out the help. It's there.
Dr. Sean Akers, pediatric psychologist, thanks so much for being with us.
You bet. Thank you.